anticholinesterase اللي هي number of synthetic organophosphate compound have capacity. يعني هنا شنو الفرق هاي عن المجموعة الأولى الريفرسبل اللي هي مجموعة الفايزوستجمين، نيوستجمين، بايريدوستجمين، دايستجمين. الهيدروفونيوم has capacity or affinity to binding to what? To the acetylcholine, to the active site, binding covalently to the active site of the cholinesterase, lead to inhibit this enzyme irreversibly, and long-lasting increase acetylcholine on all sites where it is released. Highly toxic substances lead to phosphorylate what is called the cholinesterase enzyme that's responsible for destruction of acetylcholine, and phosphorylation of the enzyme make it stable complex, not active against acetylcholine. من يصير بفوسفوريليشن نتيجة هاي الأورجانوفوسفورس كومباوند راح يكون stable complex inactive against acetylcholine، ما يسوي له destruction، وبالتالي need for a new generation of a new enzyme by the liver. At this time, this process need for 3 months or more until generation of a new enzyme by the liver. لذلك can be highly toxic substances. Some of these compounds مثل ما عرفنا present in patient راح تكون can be using as insecticide, chemical warfare agent, and in topical use as in glaucoma. These compounds very highly toxic, presented patient develop also cholinergic sign. يعني راح يسوي شنو؟ irreversible inhibition for cholinesterase، وبالتالي ما راح يصير destruction من الacetylcholine in all sites where it is synthesis and release. Central nervous system بالautonomic nervous system بالإضافة إلى neuromuscular junction. لذلك راح يصير شنو؟ cholinergic crisis by due to toxicity by these organophosphorus compound, lead to development cholinergic signs as sweating, salivation, respiratory distress, pupil constriction, muscle vasculation, bronchial secretion increase, lacrimation, abdominal cramps, urinary incontinence, convulsion, ECG changes. If patient not treated will end with cyanosis and death of patient from respiratory failure. respiratory failure هاي الضربة الكيميائية، يعني هاي nerve agent. Some of them highly toxic substances developed by military as nerve agents lead to these symptoms of cholinergic crisis and death of patient occur due to respiratory failure. Respiratory failure from cyanosis due to respiratory failure. ليش يحصل respiratory failure؟ نتيجة cholinergic crisis يصير secondary depolarizing neuromuscular block اللي أكدنا عليه leading to cyanosis and respiratory failure. التريتمنت هنا as soon as possible with maintenance of respiration by mechanical respiration, giving atropine sulfate. يعني يسأل سائل ليش الاتروبين هنا؟ mechanism of action atropine اللي ذكرناه اللي هو anti muscarinic، لكن إلى شنو تأثير for stimulate respiratory center in the medulla oblongata اللي هي yes. So giving atropine sulfate to overcome the cholinergic effect. The dose of atropine راح تكون هنا higher than that using therapeutic dose. يعني يمكن أن توصل إلى 25 إلى 50 ملغ. الأنبولة مالت الاتروبين سلفيت الموجودة هي 1 ملغ. نقدر نستخدم 25 إلى 50 أو أكثر من ملغ repeated every hours كل ساعة حتى نصير improvement في condition of patient. atropine sulfate injectable. Decontamination of the skin, eye, and stomach by gastric lavage of gastric aspiration. And number 4, not after that use enzyme reactivating libralidoxime اللي هو 2 بام. libralidoxime هو enzyme activator. احنا قبل شوي قلنا يا بطل انه الكولين استريز هذني هاي توكسيك سبستانسز تكون ريفرسبل، لكنه اكو لها بروسيسز. يعني صحيح هي تسوي irreversible inhibition for الكولين استريز، لكنه اكو الفيرست ستيج هو يصير phosphorylation of the enzyme before aging alkylated. إذا دخلت مرحلة aging alkylated بعد ماكو benefit from using enzyme reactivator libralidoxime. لكن لكن قبل هاي المرحلة، قبل لا يصير what is called the aging process، ما نريد ندوخكم بها، يمكن أن نستخدم البراليدوكسين to retain activity of الكولينستريز حتى تعيد فعاليته ونشاط الكولينستريز in destruction of الأستايلكولين. can be using enzyme reactivating اللي هو البراليدوكسين to activate الكولينستريز and act to destroy the acetylcholine. So this is the 4 important points for maintenance or treatment patient with organophosphorus poisoning. Organophosphorus poisoning with these drugs or compounds. Like مثل ما ذكرنا الايزوفلوروفيت والايكوثايوفيت اللي يستخدمون for treatment of glaucoma. الباراثيون والمالاثيون using as insecticides. عندكم ايضا بالتكست بوك another agents included this organophosphorus highly toxic substances can lead to cholinergic crisis and highly toxic may lead to death of patient from respiratory failure. So to antagonist action of cholinergic crisis or cholinomimetic drugs, we need to block what like agonists are divided into muscarinic and nicotinic subgroup. الانتي-nicotinic consists مثل ما ذكرنا. Now these two types of receptors not identical. That means nicotinic receptor in the autonomic ganglia differ from nicotinic receptor at the neuromuscular junction. Why? Because both of them need for different blockers, not like subtypes of muscarinic receptors. اللي هن from M1 to M5, all of them can be antagonized or blocker by what? By single drugs اللي هو الاتروبين. فالاتروبين هو انتي مسكارينيك، يعني هنا الاتروبين can be block one type of muscarinic one type of receptors that act on acetylcholine or cholinomimetic drugs. The another needed for different blocker. Then anti-muscarinic number 1, anti-muscarinic also called the parasympatholytic drugs, represented by atropine and atropine-related drugs. Number 2, ganglionic blocking drugs. To abolish effect of cholinomimetic drugs or acetylcholine, we need for ganglionic blocking drugs to abolish or block what? Nicotinic receptor type NN that present in autonomic ganglia. And number 3, neuromuscular blocking drugs to block what? Nicotinic receptor at the type NM that present in the neuromuscular junction. Atropine and atropine related drugs, atropine and scopolamine are alkaloid called belladonna alkaloid because they are extracted from and found in a plant known as Atropa belladonna. Atropa belladonna اسم النبات اللي يستخلص من عند الاتروبين السكوبولامين. Atropa belladonna, both of them belladonna alkaloid. The main mechanism of action of الاتروبين هو قلنا شنو؟ بلوك المسكارينيك ريسبترز. بس نشوف له تأثير آخر هو أنه كان atropine act by block effect of acetylcholine by competitive antagonist at the sites innervated by both ganglionic parasympathetic nerve fibers or nerve endings which are on the smooth muscles, cardiac muscle and exocrine glands. هذا هو المين اكشن بالحقيقة. المين اكشن اوف atropine هو what? block muscarinic receptor of the effector organs that innervated by both ganglionic parasympathetic nerve fiber on the exocrine gland, cardiac muscle, smooth muscles. Yes, يعني إذا كان الكولينومايماتيك دراج الأستايلكولين يشتغل على الماسكارينيك ريسبتور all subtypes اللي قلنا هي primarily situated at the neural effector organ اللي هي الكاردياك muscle, smooth muscle والexocrine gland. هنا blocked by what? الاتروبين. Also block الاتروبين has some direct vasodilator effect of acetylcholine. مثل ما ذكرنا أنه الأستايلكولين إلى شنو vasodilator effect of the particularly arterioles والcapillaries. هنا الاتروبين block this direct vasodilator effect of acetylcholine of the smooth muscles of blood vessels. Number 3, some block and some of atropine-related direct block effect of acetylcholine in the central nervous system and autonomic ganglia. إلى تأثير أيضا على الأوتونوميك على النيكوتينيك receptor that present in autonomic لكنه weak blocker effect beside on the CNS block. إذن هذا هو الميكانيزم of action of الاتروبين. Competitive antagonist with the acetylcholine on the muscarinic receptor of the target organ, the exocrine gland, smooth muscles و cardiac muscles. واضح اخوان؟ نجي هنا الى الفارماكولوجيكال اكشن اوف اتروبين اند ريليتد دراجز. بمعنى هنا الاتروبين هسه راح يسوي لنا شنو بلوك افكت اوف الباراسمباثيك دراجز او الكولينومايماتيك دراجز. بلوك افكت اوف الكولينومايماتيك دراج، لذلك سميناه الباراسمباثوليتيك دراجز اللي هي الاتروبين اند اتروبين ريليتد دراجز. نشوف هنا الكارديوفاسكولار سيستم small dose lead to increase acetylcholine لأنه small dose of atropine initiate or stimulate what الفيجال سنتر، والفيجال سنتر مثل ما عرفتم الفيجاس هو من الباراسمباثيك اللي هي 1972 اللي هو ال 10th cranial nerve الفيجال nerve stimulate the vagal center lead to release acetylcholine lead to bradycardia similar for action of acetylcholine with cholinergic drugs. While enough doses of atropine they cause tachycardia by blocking muscarinic receptor of the SA node lead to what the predominant راح يكون هو الادرينرجيك اللي هو النورادرينالين to act on beta 1 receptor of heart lead to increase automaticity الهارت rate and lead to tachycardia. إذن a small dose of atropine lead to bradycardia. Like enough doses can cause tachycardia. On blood pressure, large therapeutic dose in case of atropine poisoning, there will be peripheral vasodilatation. يعني قلنا الأكشن of acetylcholine أيضا vasodilatation of arterioles and capillaries with the flushing. هنا أيضا الاتروبين poisoning also associated with what peripheral and peripheral vasodilatation. أيضا سنجي نحكي عليها مو فقط peripheral vasodilatation increase body temperature and maybe due to this is a real mechanism unknown mechanism لكن نقدر نقول نتيجة الهستامين ريليز. تاخذون ايضا محاضرات الاسبوع القادم الهستامين one of the autocoids local hormones والافكت مالته ايضا يسوي لنا vasodilatation ممكن يحصل نتيجه الاتروبين administration lead to peripheral vasodilatation similar for action of acetylcholine with increased body temperature. اما ليش يصير increased body temperature؟ يمكن يكون نتيجه its effect of atropine on the thermoregulatory system or center in medulla and the hypothalamus. Number 3 GIT. اخوان ذكرنا تاثير الاستايلكولين والكولينومايماتيك دراج على الجي اي تي. شنو هي؟ انه increase انه excitatory effect that mean increase motility of GIT with increase various GIT secretion gastric pancreatic intestinal secretion with what أيضا decrease sphincter tone lead to regurgitation and diarrhea. هنا إذا صار abolish for this effect by atropine على muscarinic receptor particularly M2 M3 what lead to what decrease motility. إذا كان هناك decrease هنا decrease motility and GIT tone decrease various secretion of GIT. لكن النقطة المهمة هنا انه the first effect اقصد ب decrease motility by atropine on the GIT and decrease with an increased sphincter tone. Now this effect more than that second one, more than the decrease or its effect on the secretion of GIT. يعني بمعنى أنه الأتروبين doesn't decrease الgastric parietal cells for الهيدروكلوريك acid. Yes. So in peptic ulcer, they are substituted by other drugs more selective and less adverse effect. واضح؟ يعني هنا الأتروبين يقلل yes motility of GIT from the stomach to the colon with the prolonging the emptying time of the stomach, but has little or lesser extent to affect or to decrease the various secretion of GIT. بمعنى أنه not benefit to reduce or not effective الأتروبين to reduce the secretion الهيدروكلوريك acid secretion أو acid secretion of the stomach for a treatment patient with peptic ulcer. But in contrast, may be worsening patient with peptic ulcer from prolonging the emptying time of the stomach. Clear? يعني هنا يقلل لنا الموtility, yes, and increase sphincter tone associated with constipation adverse effect, yes. لكنه not used for a treatment of peptic ulcer because it is not effectively reduce secretion of gastric acid. Yes, so it is substituted by other drug more selective. بالمناسبة انه يعتبر مثل ما عرفتوا انه شنو الاتروبين يعتبر شنو نون سيلكتيف الاتروبين نون سيلكتيف muscular receptor blocker نون سيلكتيف لانه بلوك فور اول سب تايبس اوف ريسبتور لكنه اكو مور اللي قلنا عليها المبرومنت اللي هي الام 2 او الام 1 that presented the parietal cells والام 2 muscarinic receptor اكو selective M1 blocker can be effectively used for a treatment of peptic ulcer like pyrinzabine or tilinzabine. This is M1 selective M1 blocker rather than non-selective while atropine, which is less benefit from it. On urinary tract الاتروبين ايضا اخذنا الباراسمباثيك شنو تاثيره كان؟ enhanced micturition by the dorsal muscle contraction and relaxation. أخذنا urinary. On urinary tract, atropine has some dilating action on the ureters and fundus of the bladder. In addition, it is lead to sphincter constriction and thus cause urine retention. يعني العكس effect of acetylcholine اللي هو صار هناك enhanced micturition or urination by the dorsal muscle contraction and then decrease sphincter tone. هنا لا, increase sphincter tone will be occurred by administration of atropine block muscarinic receptor at the sphincter region with the predominant alpha 1 adrenergic action that lead to an increased sphincter tone associated with development urine retention. هنا هذا التأثير يعني مهم يعني من قلنا سوي dilating action للureters والfundus of the stomach of the bladder. This is utilized from it and as antispasmodic action to decrease the pain of urinary bladder due to mild inflammation like cystitis or due to surgical intervention or neurological condition. But in other hand, it is associated with the sphincter constriction, and this is very serious in elderly men with benign prostatic hyperplasia. اللي عنده benign prostatic hyperplasia تضخم بروستات هذا الاتروبين contraindicated لانه يصير شنو urine retention وهي ايضا اساسا تضغط على اليورينري بلادر. Gallbladder have some mild antispasmodic action on the gallbladder and bile duct. يعني عندها شنو antispasmodic action بالاضافه للجي اي تي يقلل ايضا antispasmodic بالاضافه لليورينري bladder مثل ما ذكرنا but associated with urine retention which is may ايضا contraindicated in patients with old men with prostate hypertrophy. On uterus has negligible effect, no significant effect الاتروبين effect. So it is not used for a treatment dysmenorrhea اللي هي painful menstruation. بينما السكوبولامين اللي هو another alkaloid belladonna alkaloid used in the second stage of labor. Second stage أقصد بها أكو تاخذونه بالأوبستريك الفيرست ستيج والسكند ستيج والثيرد ستيج for normal delivery. And on the second stage can be using the scopolamine to induce sedation and amnesia without effect on uterine contraction or the duration of labor. On the eye الاتروبين شو يسوي لنا اذا كان استالكولين مثل ما اخذنا شو راح يصير هناك mydriasis with accommodation of eye foreign nerve vision and decrease intraocular pressure. هنا راح يصير شنو؟ الاتروبين راح يسوي لنا circular muscle of pupil and the ciliary muscle receive cholinergic innervation block it lead to اللي تكون predominant هي الالفا 1 of radial muscles of iris lead to dilatation of pupil اللي هو المدرياسيس with accommodation of I4 far vision and lost accommodation of I4 near vision هاي يسمونها cycloplegia. Cycloplegia يعني accommodation of I4 near vision is lost and its accommodation for far vision is increased. This is called cycloplegia. يعني الاتروبين عنده شنو مدرياتيك افكت cycloplegia والتاثير الاخر اللي هو على اللاكريمال جلاند اللي هو opposite to action of acetylcholine lead to decrease secretions of lacrimal gland secretion lead to dry eye. إذن three effects. There is mydriasis, cycloplegia, the accommodation of I4 near vision is lost with accommodation of I4 far vision is increased. Also, there is an increased intraocular pressure. Increase intraocular pressure بالإضافة إلى the dry eye. In exocrine glands, secretion all will be reduced. Salivation, lacrimation, لذلك راح يصير dry mouth, dry eye, dry skin, except the milk secretion. هذا المilk secretion ليش يصير به exceptions إنها not affected by الاتروبين like الgastric secretion والpeptic secretion والintestinal secretion. هذين يكونن under hormonal control rather than vagal stimulation or parasympathetic stimulation. لأنه under hormonal prolactin hormone responsible for milk secretion not like rather than vagal stimulation. لذلك تأثير الأتروبين هنا يكون ماكو له تأثير على المilk secretion أو الgastric secretion أو الintestinal GIT secretion. On CNS, scopolamine has more marked CNS sedation and drowsiness with amnesic effect in recommended doses. In toxic doses, the scopolamine and lesser extent atropine can cause excitation. عرفنا تأثير acetylcholine على CNS lead to mental excitement, restlessness, tremor, agitation, nightmares, insomnia مثل ما ذكرنا, dysarthria, even convulsion in high doses and coma. هنا السكوبولامين rather than and with lesser extent atropine can cause excitation, agitation, hallucination, and coma. The tremor of Parkinson's disease is reduced by centrally acting antimuscarinic drugs. The vestibular disturbances especially هو طبعا innervation muscarinic innervation خاصة motion sickness هنا فالسكوبولامين يسوي block element للmuscarinic receptor and innervations lead to more effective in preventing these disturbances. The scopolamine. على respiratory system شنو تأثير كان الacetylcholine increase bronchial gland secretion with bronchoconstriction and contraindication مثل ما ذكرنا الcholinergic drug in patient with bronchial asthma. الاتروبين هنا block الcholinergic drug on the muscarinic receptors أو acetylcholine action lead to bronchial dilatation and reduction of bronchial secretion. لذلك الانتي ماسكارينيك drugs اللي هن الاتروبين and atropine related drugs frequently used prior for administration inhalational anesthesia to reduce accumulation of secretion in the trachea. يعني some anesthetic inhalational anesthetic drugs stimulate bronchial gland secretion and induce laryngospasm and bronchospasm. To avoid the suffocation or adverse effect of inhalational anesthetic drugs like the مثل diethyl ether must be administered prior to this anesthesia atropine or atropine related drugs to protect patient from suffocation. In ophthalmology مثل ما ذكرنا they are used to induce mydriasis and cycloplegia, but because of their يعني هنا نجي نحكي على therapeutic uses of what? Therapeutic uses of atropine. وين نقدر نستخدم الاتروبين and atropine related drugs؟ اولا in ophthalmology to induce what? Mydriasis and cycloplegia. Mydriasis, dilatation of the pupil with the cycloplegia, accommodation of eye for far vision and lost accommodation of eye for near vision. هذني important for ophthalmologists for measurement of refractory error, mydriasis and cycloplegia. لكنه استخدامنا للاتروبين هنا يكون الاتروبين long duration of action، يعني يمكن يستمر تاثير هاي المدرياسيس والسايكلوبليجيا for more than 3 days, more than 72 hours، اكثر من 3 ايام. لذلك substituted استبدلت الاتروبين by short acting antimuscarinic drugs like الهوماتروبين، التروبيكامايد، or by using alpha 1 adrenoceptor agonist مثل ما قلتوا محاضرات الادرينرجيك سيستم like الفينالفرين اللي هو alpha 1 adrenoceptor agonist الفينالفرين as eye drop for induced mydriasis, or short acting antimuscarinic like الهوماتروبين and التروبيكامايد. شنو الهوماتروبين هنا والتروبيكامايد؟ هذا هو shortest acting antimuscarinic drugs. الديوريشن الاكشن مالته يمكن فقط نص ساعه الى 4 ساعات. not like الاتروبين اللي يمكن يستمر تاثير المدرياتيك والسايكلوبليجيا for more than 72 hours and this disrupt the patient. Yes, using substituted drugs for like الهوماتروبين and tropicamide. Pre-operative لأن قبل شوي ذكرنا to protect the patient from excessive salivation and bradycardia that produced by some general anesthetic, especially ether, diethyl ether. هذا يسوي لنا شنو؟ stimulation or excitation for upper respiratory tract, salivation, laryngeal spasm, bronchospasm. This will lead to suffocate the patient. To protect patient from this adverse effect of inhalational anesthesia can be giving atropine, and it is become part of routinely pre-operative administration or medication. يستخدمون الاتروبين routinely to protect patient from this excessive salivation and the bradycardia that induced by some general inhalational general anesthesia like diethyl ether. واضح؟ In obstetric ذكرنا انه السكوبولامين using in the second stage of labor. احنا ذكرنا انه الاتروبين has negligible or no significant effect on the human uterus, but the scopolamine, so for this reason not used for the treatment of dysmenorrhea, painful menstruation, but the scopolamine can be using in the second stage of labor to induce sedation and amnesia, temporal amnesia. This is important in the second stage for labor without effect on what? Uterine contraction or duration of labor. Another indication of atropine drugs here in cardiac use. They can be used to reverse bradycardia associated with and after myocardial infarction. بعد ما يصير myocardial infarction MI يمكن يصير شنو؟ bradycardia. To reverse this bradycardia associated with and after myocardial infarction يمكن أن نستخدم الاتروبين. and in digitalis induced heart block تاخذون محاضرة الهارت فيلر والديجوكسين، يمكن واحدة من ميكانيزم اوف اكشن مالته يقلل اي بي كوندكشن وبالتالي يصير هارت بلوك. لذلك to overcome يصير شنو؟ bradycardia. To overcome bradycardia associated with or after myocardial infarction or in digitalis induced heart block can be using الاتروبين هنا. in Parkinsonism، هذا الباركنسونيزم ايضا هو progressive neurological disorder. بالحقيقه يحصل نتيجه شنو؟ ناخذ ايضا محاضره انت بوحدها. يحصل نتيجه الدوبامين ديبليشن عند الاكسترا بايراميدال سيستم، اللي هنا بالاكسترا بايراميدال سيستم عندنا تو امبورتنت سيستم، الدوبامين والاسيتايل كولين. اللي يحصل بالباركنسونيزم انه الدوبامين يقل، يصير ديجنريشن بالدوبامينرجيك نيورونز in the extrapyramidal in the nigrostriatal pathway in the substantia nigra، يقل الدوبامين والاسيتايل عالي. فنحتاج الى centrally anti-muscarinic drugs to return activity of acetylcholine to level of الدوبامين. فنحتاج centrally acting anti-muscarinic drugs like البنسكسول, benztropine, or phenadrine to improve tremor associated with this disease. And the treatment also organophosphorus قبل شوية الorganophosphorus compound treated with what? With atropine, using in high doses more than therapeutic doses, beside mechanical ventilation, decontamination with gastric lavage, and enzyme reactivating اللي هو البراليدوكسين 2-VAM can be used for treatment organophosphorus poisoning. Motion sickness مثل ما ذكرنا الموشن sickness يا استخدمنا أمول atropine سكوبل أمين as vestibular disturbances mediated through muscarinic innervation. لذلك using السكوبل as anti-muscarinic to prevent motion sickness rather than treatment. بالحقيقة يكون more effective in prevention as a prophylaxis can be using scopolamine for treatment motion sickness rather than treatment that occur due to vestibular disturbances by mediated through muscarinic innervation, cholinergic innervation. Number 8, cholecubane. لأن قلنا الاتروبين decrease the motility of GIT. The gallbladder has antispasmodic action, relaxation, fundus of the urinary bladder. So utilize it from it as antispasmodic for a treatment cholecubane of GIT and urinary tract and used by mild inflammation or surgery. Yes. And then the most important therapeutic indication of atropine and atropine-related drugs like abratropium يعتبر quaternary derivative of atropine that is useful in treatment of asthma and also beneficial in management of chronic obstructive pulmonary disease. يعني بدل ما استخدم الاتروبين for treatment of bronchial asthma with many adverse effects can be using the quaternary derivative of atropine اللي هو abratropium for treatment of bronchial asthma to avoid adverse effect of atropine. Yes, then هنا الاتropine related drugs that inhale condition because of positive then abratropium not فقط على respiratory system because it is more polar, doesn't enter systemic circulation and not affect or enter to the CNS. The contraindication of atropine and atropine glaucoma. Why? Because it is an increased intraocular pressure. The contraindication to using atropine in treatment in patient glaucoma, patient with glaucoma. Number 2, prostatic hypertrophy. لأنه يسوي urine retention. سوينا urine retention نتيجة increase sphincter tone by effect of sympathetic on the alpha receptor of the urinary sphincters lead to urine retention. Sphincter tone increase with urine retention. So it is contraindication in patient with prostatic hypertrophy. Atropine also contraindication in patient with glaucoma. أرجو أن تكون المحاضرة واضحة. شكرا لكم. أتوقف هنا ونكمل إن شاء الله محاضرتنا باكر.